The Confidence Doc podcast is brought to you by My Evergreen Med Spa. Located in Houston in the Woodlands, My Evergreen Med Spa brings to you the latest aesthetic treatments in the most luxurious environment. Remember, My Evergreen Med Spa, it's me time elevated. Welcome to the Confidence Doc podcast. I'm Dr. Rednam, and I'm a board-certified plastic surgeon in Houston, Texas. And we have today Dr. Patrick Davis, who is a facial plastic surgeon based out of Los Angeles. Welcome to the show.
Thank you for having me. I'm excited to discuss everything we want to talk about.
So tell me a little bit about yourself. How did you get into this area?
So facial plastic surgery is a journey for me. I was actually in the Peace Corps during the time of Haiti and the Dominican Republic when there was a big earthquake. And I never thought I was going to go into medicine. My sister's an emergency physician, so I thought that I was going to do something else. I shadowed and translated care for orthopedic surgeons and general surgeons, and even plastic surgeons, especially reconstructive plastic surgeons. And it just was fascinating to me. So fast forward, I did my residency in head and neck surgery, and then that is a natural segue into facial plastic surgery. And so now I reside in Beverly Hills, and I just love, and I think maybe you could attest to this, in our field, just blending the artistry, and there's oftentimes plastic surgeons have an artist bent, but then also with cutting edge, science and technology, it just is it's a nice blend of both worlds.
I totally agree with you. I think we all have something artistic in us because we're the artists of the medical world.
Absolutely.
So
it's essential, to be honest. Yeah.
And so you said you started off, you did a lot of reconstructive surgery. Is there a point where you kind of started transitioning, or you just sort of like, you know what, I really want to move into more of the aesthetics?
Yeah. So my residency in Emory was heavily reconstructive based, especially a lot of cancer reconstructions of the head and neck. And we definitely had a component of facial plastic surgery that I was drawn to. I mean, I remember one time, especially from a child, for example, child trauma, and reconstructive aspect, there was a surgeon that would oftentimes put up old pictures of what that person used to look like in the operating room to recreate and kind of restore the self-image of that particular person. And just blending that artistry really moved me towards a little bit, I still do reconstructive aspects, but just moving more towards an artistic, aesthetic side of things. It's almost equally as powerful for somebody, and I'm sure we can talk about this. I mean, just empowering people and giving them more confidence is a pleasure, and it happens day in, day out in what I do.
It is. It's I think that sometimes people will make quick judgments about being vanity. But I think that all of us in our specialties see that there's so much more to it than that, that there is so many more positive benefits. And you cannot put like a price on someone feeling confident and good about themselves.
You really can't. You're right. And it's really hard to quantify that. There's no scientific papers that necessarily can quantify confidence.
Yeah.
But certainly I see it, and it's a privilege. I don't know if you experience this with your patients, even on the recovery journey. Patients, yes, are recovering from their surgery, but oftentimes there'll be other transformations. I mean, I have patients that, quit smoking or lose weight or go out into the dating pool. Some learn to meditate, all in this recovery journey because they're kind of entering back into the world with a renewed sense of confidence.
Yeah. And it's really cool to be able to be a part of it, right?
Yeah, absolutely.
So a lot of things have, I think in the recent, in current times, a lot of things have changed, right? We're seeing a lot more people who are having weight loss, especially with the GLP-1 medications. Yeah. Are you seeing that in your practice? A lot more people having what everyone's coining Ozempic face? Yeah,
that's definitely something that's coming into my office more and more. And that's a question even on our itinerary, our intake forms, what kind of weight loss medication if you're taking it. Yes, it is. I've spoken about this. I believe it is almost accentuating the aging process. It can. So it's something that everyone needs to be aware of that is taking this drug, to go low and go slow with the weight loss. But we're also seeing some scientific studies that even the fat that's related to our face, that does have natural stem cells in them, that kind of regenerative fat that kind of give us our skin that plumpness. We are seeing that perhaps some of these drugs are targeting those things as well, those areas, which is kind of, it's not just volume loss, which what we thought was really the issue, which it is, but also there is a textural component to the skin. So we're new in learning about these GLP-1s, but by no means, I'm sure there's cardiovascular strengths with these. There's a lot of positive things related to it. So we're just kind of we're a little bit on the forefront of the aging process with these. And yes, I'm seeing them come into my clinic. Probably at least 20 to 30% of people that come in is related to something like that.
And I think you make a point. Like there's a lot of really positive benefits. These medications, we still don't fully even understand that full extent. But it's just being another thing for people to be aware on, if they are on these medications, that hey, like this is expected almost at this point. But there are things that you can do about it. What are you finding is something that's become common with somebody who's specifically coming in because of this rapid weight loss, like interventions that you're doing?
Yeah. I divide things into more volume restoration and also the textural changes to the skin. So from a volume standpoint, I am moving more towards facial fat transfer. So that's taking fat from the other part of the body and placing them in those areas, especially around the cheeks. Sometimes even the temples have had loss, and restoring those compartments with their own tissue. There are other procedures that you can move some of the orbital fat down into the cheeks as well. So there's a volumization. Sometimes even a well-done facelift that's lifting kind of the structural components up can be just enough for that. And then treating the skin. So the skin can be treated with topical products, and we always have conversations about that. We can talk about microneedling, CO2 laser, things that help at least bring some structural component to the skin. Like I said, some of the fat cells that some of these GLP-1s target may be more thinned out, so we need to help that skin. So there's really two components, the volumization and also the skin texture.
Do you have patients wait till they are stable with their weight loss? Like, what if somebody's coming in, they're actively, like, I guess, what advice do you have for somebody who's like, I don't like how things look, but I still want to lose more weight?
So when a patient comes in and they're on a medication or just in weight loss in general, I say 10 to 15 pounds within your target weight is a ideal place to be. If you're beyond that, then when you have the procedure, especially a facelift, and you do lose 20 or 30 pounds, there's going to be a negative consequence of losing that much weight. So that's, 10 to 15 pounds is fine. And oftentimes people will use the date for their surgery as a motivating way of getting to whatever that goal is. Most times my patients are 2 or 3 months out. So there is, in a healthy way, getting to those goals is oftentimes what patients do.
Yeah. And I think that makes sense, right? You don't want to try to, I always tell people, we don't want to build on a moving foundation.
Yeah, that's a good point.
So in addition, we're also seeing a lot more younger patients who are seeking out interventions. And are you seeing that? And what kinds of procedures are you seeing? So the Wall Street Journal, I think a few months ago, came out with the article about that, just highlighting that trend. I went on local television in Los Angeles with one of my patients who's 38 years old that had a deep plane facelift. And that is a trend that I'm seeing more and more. And I attribute to people being more informed about the procedure. Techniques have changed. Your techniques that were 30 years ago are not the same thing that is done now. We are in an era of undetectability, subtlety, more natural aesthetic through surgery, and I think all those things are contributing to that. And
I don't have to necessarily put words in my patient's mouth, because they tell me that they want something a little more durable, a little bit more long lasting. They don't want to have to keep coming into the clinic for tweaks. And then that's fine if other people want to go down that route. But for certain patients, they want that natural aesthetic, and the techniques have advanced to the point where we can meet them where they are.
Are you finding that some of these younger patients are not necessarily coming in because of aging, but they actually want to use facelift techniques and things to actually change their aesthetic?
Oh, that's a good point. I don't necessarily get a lot of people. I would say maybe 2 or 3% of my practice will come in to want to change their aesthetic. That now we're getting into more gender affirming, those patients for me, with as far as, and I have had, it's actually fascinating conversations about what makes someone masculine, what makes someone feminine. And there are some patients that want a blend of both of those things. So that certainly has come into my practice, but usually it's more in the realm of gender affirmation.
And, with Kris Jenner, right, she was very vocal about her facelift, and all of a sudden everyone was like, what's the best facelift? And that, as you and I both know, that's not always the most easy answer. Yes. But like, a lot of people want to know, okay, what makes a deep lift, plane lift so special? Why are people talking about it so much?
Yeah, the deep plane facelift is not necessarily a new technique. It's become more popularized in the past, I would say, decade or so. It's certainly at our conferences at this time, there doesn't seem to be a debate anymore about whether the deep plane technique is better or worse than others. It really is becoming the gold standard. And the idea behind it is we're lifting. If you think about like a bed, you're making your bed, you have a blanket on top and a sheet underneath. The blanket's going under the skin, only just a little bit under the blanket, but it's under the structural element or the sheet itself. And that's what I'm able to lift. And as I'm sure the more vertical we can make things, the better it is. So our cheeks have fallen vertically, and that's not any surprise, but it's important to put them back to where they once were. And that is what's giving people, I feel, a more durable and natural result. And that is part of this, things aren't the same 30 years ago. So if I can get that procedure at a younger age, I can, live with it for a longer period of time.
Yeah. And I think that's important, is that you're, like you said, you're thinking about the layers and anatomy. Because I've had actually somebody recently reach out and said, I just need a little tweak so that I could do preventative things. And I'm like, well, little things make little results, right?
Yes.
And so sometimes the idea of a little tweak, well, it may not look good in 6 months to a year. Do you really want to do that then,
I agree with that. And as surgeons, I think there's a stigma in plastic surgery in general that, the surgeon's trying to sell you something. I think a lot of that has gone away. I like how you said it. It's little things can do little things. And sometimes a more comprehensive approach is the better way from a looking for someone to look natural, because it's not just little things that happen to our face. Oftentimes there's a lot of things happening in concert. Nature just published an article, I think it was like 6 months ago, that looking at the aging process. I used to think that aging was a gradual thing, but there's actually like loci or centers of aging, like around the 40s, around the 60s, where there's a big just drop in male and female, like heart markers, lung markers, but also skin tones. So I don't know if you've had this experience where someone will come in and say, Doc, I feel like my face has just fallen off. And I used to not believe it. But now I'm like, it actually could happen. So just because, we talk about people in their 60s getting these procedures, there is a time around your late 30s, early 40s where there is a precipitous change. And so a lot of people are saying, well, why not? Why can't we address it then? Why do I have to wait till I'm 60 type thing?
Yeah. And I mean, I think that's reasonable, right? Like to think that way. And I mean, we even see within different ethnicities that time period might change. Yeah. I was joking with, I'm Indian, and like, we don't look old till one day you wake up and you're old.
Yes. Yes.
And so it's like, if you can do certain things that are preventative before that happens, why not? We're living longer, so why shouldn't our quality of life continue to be better?
Absolutely. Absolutely.
Are you noticing that you're seeing more men getting these procedures, or do you feel like this is strongly still mainly women that are coming in for things?
No, I think that goes. Yes, I am seeing more males come into this practice, into this field, because of more information out there for others to digest. I think that our patient population in general is a lot more informed, which I think is a great thing, and so that has trickled over to men. I think we've seen an uptick definitely in hair transplantations for sure. Men oftentimes with me want to work primarily on their neck, not necessarily doing the full facelift. And then especially their under eyes. That's another area most men are focused on. Men tend to want a more subtle result. They don't want to necessarily change the way they look. They don't want necessarily a statement, but oftentimes, you have real estate agents or people that are forward facing with cameras that, people will say, if you got enough sleep, you look tired. And I think my patients are just tired of people saying that to them and
saying that about them. Yeah.
They don't feel tired,
Do you find that there are some additional challenges with men, because most men don't wear makeup, right? So it's easy to be like, oh yeah, you can wear makeup in a week, but guys, like, there's that, they don't generally have that to hide.
Yeah.
And is that like a concern that you see amongst men who come in for the procedures?
Yeah. So what men don't have with makeup, they do have with a beard. So the beard.
Yeah, that's true.
From a recovery standpoint, and this is the fun part about this job too, is the recovery aspect. You can grow out your beard, especially when you do a neck, and there's actually more protection from a cosmetic standpoint, more cosmetic downtime is what I like to call it. It's blunted by the beard, whereas someone who does not have that, you can see the bruising and stuff like that. With men, I do have to take into consideration where that beard is, though. So if we're moving that beard, sometimes those hair follicles will be in different locations, so we have to have a nice conversation about that. Men tend to have more body mass, so there is an issue that I have to often talk about with blood pressure issues, any kind of precautions that I have with bleeding, and certainly in the face, bleeding is never necessarily life-threatening, but it's important that we have those conversations. So yes, men not only from an aesthetic standpoint, but from a whole surgical approach is different.
And I agree with you. It's rarely life-threatening, but our faces are important to all of us, men and women.
Oh, yeah.
And so I think there's still, the bar is sometimes even higher because you can't hide your face.
No,
so momentarily during recovery, but if something doesn't go well, it can be really traumatizing to anybody.
Yes. And that's the truth. And I tell people that, this is a process of recovery. So, yes, some people can look great after a week or two, but some people just take a little bit longer to recover. And I oftentimes say 3 to 6 months from a recovery journey is very reasonable to think about. We have a lot of fluid shifts, so we have swelling in different area. The lymphatics kind of open up sometimes in different time frames. So sometimes you'll get some different fluid shifts, and it's a privilege to be part of people on that journey and walk them through this process, because they learn more about themselves. They learn more about their body. Some people are journaling the process. It's a fun experience.
And I think we've moved very much into more of a wellness era. Mm-hmm. That's become something really important. Are there things that you've added to your practice, like for both the pre and post recovery? There are people doing hyperbarics. There are people doing peptides. Have you found any benefit to any of these things?
Yes, that's a good question. We do simple things like arnica and bromelain, and bromelain's in pineapples. I believe it can help minimize bruising. Yes, you brought up hyperbaric oxygen. I'm such a firm believer in hyperbaric oxygen. I recommend doing one the day before your surgery, and at least 2, sometimes even the day of surgery afterwards. Our nurses can take them to the actual chamber 2 times after, is like a minimum. And what I notice with hyperbaric oxygen is that, especially when I come to take the stitches out in the 7-day mark, swelling and the bruising is significantly different than somebody who had not done hyperbaric oxygen. Now, I think in the end result will be the same, whether you do that or not, but you will get there a little bit sooner, I found, if you do hyperbaric oxygen. So that's one. And then I've really gotten into lymphatics. So I have a lady, Cecilia Braden, she invented a brush in New York, which I really talk about around the 3-week mark, where you can self-use this brush to open up different channels and kind of move that fluid out. I think that's really important for us as well.
And I agree. I think lymphatics anywhere in the body, like it's really, we're understanding better why we have continued swelling and edema. Like, and so if we can assist that, doing something as simple as like knowing the proper ways to clear those channels and opening brushes, I think that's amazing.
Yeah.
For those of our listeners who aren't familiar with what hyperbaric oxygen is, can you explain like why would you do it before surgery?
Yes. So in the atmosphere that we have right now, there's a certain percent of oxygen that we have. Oxygen is very important for wound healing and tissue. So oftentimes you'll see hyperbaric oxygen used for people that have, for example, diabetic ulcers or things that, wound healing components, because oxygen is an important part of that healing. So doing it a week before likely won't do anything, but like within 24 hours prior to the surgery, you're loading your body with increased oxygen stores, because these chambers that you go in are, they increase the partial pressure of oxygen. So there's more oxygen in the air, and that's why they're pressurized. Some chambers are soft. Those tend to be more for athletes that are recovering. They're soft kind of shell chambers. I think those have marginal benefit. In this particular situation, there are kind of medical grade that I'm sure in any major city you can get these, where it's actually a hard shell area where you actually walk in. Sometimes you're in a tube. So if you're in a tube, there's some discussion I have with patients about claustrophobia. But if you have a more broader chamber, that issue doesn't necessarily come up. Though, if I had to say one thing from a recovery standpoint, if you're interested, for example, if you're going to go to the Grammys or the Oscars in like 3 or 4 weeks, that would be something to really do. And minimum 3 sessions.
Yeah. I think it's a concept that's been around a long time, but it's definitely gotten a second wind now that what people are realizing the benefits, especially when it comes to aesthetic procedures.
Yes, absolutely.
There is been a lot more celebrities that I think are being transparent about having aesthetic procedures. And I think that that's really important because there's a lot of young women and men that are watching them. And there's certain things they're only going to achieve through procedures. And being honest is great. Some people have met that with a lot of positivity, but a lot of people have also met it with a lot of negativity. So what are your thoughts, especially being Los Angeles based? I think you may be more in the present than some of us are.
Yeah, social media is definitely a force in our ecosystem of plastic surgery and most industries in general. The positive thing is more and more patients are more informed. So the curtain has been lifted on techniques, and it is oftentimes a great teaching tool with my patients, because they'll come in with more of an idea of what they want. There's a lot of these apps that you can morph your nose and things like that. And I used to be more against those, but actually now it helps that surgeon-patient relationship, because we really can understand what someone wants to achieve. On the other side of the coin, yes, I think there is sometimes social media, and seeing more and more celebrities being more transparent is driving this practice as well. It's important as surgeons ourselves to, no matter why someone comes into our office, to screen them for certain issues like body dysmorphic disorder. I don't necessarily know if that's increased in the past years, but 5 to 10% of our patients will have body dysmorphic disorder, and it's our responsibility to identify that and not necessarily operate on people that aren't necessarily ready for it or don't see the issues the same way that we see them or society sees them. So I think it only increases, and I'm sure you would agree with this, that it only increases our responsibility as surgeons to operate on the people that are psychologically prepared for operation and will get through the process.
No, I 100% agree with you. There's just so much more out there, and so we want to make sure they're always being realistic with our patients. And because we're surgeons, we operate on people, but we still take care of people's minds.
Yes.
And so I think there's an equal responsibility on both parts of that.
Yeah, I understand.
I was like, what are some things that you are excited about coming up? Like, so that you are seeing future things in facial aesthetics world?
So I really geek out, I guess, on technique. I enjoy that aspect from a surgical standpoint. I'm moving more and more towards, and even today I did a procedure this morning, preserving the skin whenever I do surgeries. So we talked about in a deep plane facelift, we're going under the blanket in the bed analogy, and really pushing the envelope of trying to take off less and less of the skin to get our results. So even to the point where I'll go under into the neck and dissect and get everything that's necessary out to make a nice neck. But then this band of tissue right here, that skin, I will actually not lift off. And so, which is really kind of counterintuitive these days. And so I'm not devascularizing or taking that skin away from its deeper structures. And what I'm noticing is improved recovery times, less bruising. It's just a better technique. So I, as a surgeon, in this day and age, it's fun when we talk about social media is that there's so much discussion about these things that people used to not care about at all. Like patients used to care about at all, but it's fun to be part of that discussion. And so I guess that's something that really excites me.
When you're doing more of this, and I think preservation, as like someone who has a lot of body, is becoming that also a theme there. Where like, how do we preserve like breasts even? Like, how do we do things with? We want to augment or change things, but how do we still try to preserve as much structure as possible? When you are doing this, are you finding then you're combining a lot more like resurfacing treatments and things because you're not devascularizing that area in the same way?
Yeah, so you hit the nail on the head with the phrase preservation. We are preserving those tissues. And yes, I can go, for example, when people are asleep, I oftentimes say that the surgery itself will help the structural components, but the texture of the skin oftentimes will need treatment too. And you bring up something like CO2 laser. I think CO2 laser, in my experience, is the strongest laser from a facial resurfacing standpoint. And yes, because that skin is not lifted nearly as much, you can go stronger and help some of those fine lines and wrinkles. And I think you and I are on the same page. This is not saying that we're going less skin as far as being lifted. We're actually doing all of that work on a deeper plane. And the fun part about this is the skin is never really the problem. I think that's the thing about 30 years ago is skin itself was deemed the problem. So that's if you pull really hard, then that'll be solve everything. What that often does is it can cause some scarring in this area. It can also, the skin is not designed to lift up everything, so you get kind of like swooshes in people's faces over the years if you've had a more of a primarily skin facelift. So yes, not relying on the skin and like honoring its function and its location really, I think is kind of the next level, the next evolution of where we're going.
And we really, they keep saying we're in the era of quiet aesthetics, right?
Yes.
Things look beautiful. And I think that's actually kind of the fun of stuff I have seen on social media. They're like, did she or didn't she?
Yes.
We don't know. And that, as a plastic surgeon, is the highest compliment. If someone just thinks you look amazing and they can't tell you had something done.
Yes. And I always say the best plastic surgery doesn't really make the news because the ones that do make the news are kind of like the bad ones, and that's what and like things happen, and I understand that, and more people than probably not you, but our listeners have had something done, you just don't know that it's been done because it's been done subtly, it's been done naturally. Another word is we're in the undetectable era. So you're right. I get all the time, I'm sure you do too, where there's news outlets that ask me, has somebody had this? Has somebody had that? I don't particularly enjoy commenting on those things because certainly I'm not the surgeon in most of those cases, and I don't want to presume anything. If we're having to kind of think about, did something get done, that's actually a good thing because it's, you don't really know what was done. And more times, more and more people are looking better and better.
And I agree with you. It does get a little old. It's like, you want me to guess? Yeah. I mean, if it's for education purposes, potential things, but at the end of the day, I don't know. I wasn't their surgeon. I don't know.
Yes, yeah, exactly. I often pass a lot on those because it's just, it's not fun. I would imagine it's not fun for a celebrity to be judged just as much as a non-celebrity to be judged.
They're still humans. Yes, they're still humans. Yeah. So if somebody's listening and they're like, oh my gosh, I need to see Dr. Davis, how would they find you?
I'm in Beverly Hills. I'm in the kind of center of Beverly Hills here. Davis Facial Plastics is the name of our practice. We were happy to see anybody internationally, nationally, in the local area. So and you can find us on Instagram, Dr. Patrick K. Davis. We're only a phone call away. We don't have bots answering our phones. We have actual people answering our phones, so that's good.
Well, that's awesome. And you should please check out his social media, his beautiful results. And Dr. Davis, thank you so much for being on the show with us today and sharing your insights.
Yes.
And as always, everybody, thank you so much for being and listening to our podcast today. And I hope you learned something. So tune in next time for the Confidence Doc podcast.